Um, Welcome you all. I'm Judy Alden, president of the DC HLAA chapter. And I usually have Bluetooth for sound, and it's wonderful. For some reason, after 20 minutes of trying, Bluetooth is not connecting, so I have no audio. So thank you, Natalie, for wonderful captions. Just so you all know, if I have a little delay, it's because I'm totally reliant on captions. I cannot hear you all, but the captions work. So sorry about that caveat. And usually Bluetooth is terrific, by the way. Anyway, welcome. So glad to have you all with us. Russ, thank you for, swearing us all away technically here. We have a nice group of people. It's wonderful to have a joint program with the HLAA-DC chapter and the Montgomery County, Maryland chapter. Welcome everyone. What I'd like to do quickly, very quickly, is just do a quick look at Zoom to be sure everyone, by now we're probably all zoomed out, but to be sure everyone is effectively using Zoom for the purposes of this program. Then I will ask Lise Hamlin with the Montgomery County chapter to say a few words, and then we'll pass it back to Russ, who's past president of the DC chapter, and I'm very pleased to say kindly continues to arrange these monthly programs, line up topics and speakers, and for that we're very appreciative. Quickly about Zoom, you all know. Everyone's not on mute. Thank you, Tat. Could everyone please go on mute? That's appreciated, so we don't hear. I can't hear anything, so thank you for telling me when people are not on mute.
I guess that should be a given, but
Zoom, of course, as you know, we have captions. Everyone have access to the captions. If you go to the icon at the bottom of your Zoom screen, you'll see CC. That enables you to access captions, should you choose. Montgomery County and DC meetings include CART, which is a live captionist, which in a situation like this, I particularly appreciate. Also on the bottom of your screen is a chat icon. If you have a burning question in the moment and you don't want to lose it, and you want to be sure to address before the end of this program, please enter it in the chat function. That will enable us to be sure we're not missing anyone's issues or concerns. Both of those boxes, by the way, can be moved around on your screen. Just click over the box and move it wherever's most convenient for you, so it's not covering something else you might want to be seeing. With that, I think, well, let me mention something that is always worth repeating. HLAA, as you know, is a membership-based volunteer organization. Your membership, your donations, your contribution, time and talents are always welcome and appreciated. That's how we're able to do what we do, including things like this program, chapter activities, including advocacy, and something that I know Lisa's leads from National is very familiar with. So we appreciate, if you have questions about the chapters or National, please don't hesitate to let us know. We welcome your involvement. Lisa, with that, I'll turn it over to you if I may.
Thank you, Judy. I'm Lisa Hamlin. I'm the Director of Public Policy at Hearing Loss Association of America. But today, I'm here as a member of the steering committee for the Montgomery County chapter of Hearing Loss Association. And we are very happy to work together with the DC chapter to pull this together. There's a lot of people here. We're really appreciative of that. I'm sure that's also because of the wonderful speaker we have today. So thank you for coming here today with us. I wanted to mention a couple of things. One is that if you're interested, one of the nice things about Zoom is you can join pretty much any chapter in the country as long as you're aware that it's there. So for example, we have somebody from California, hi Dana, joining us today. You could be anywhere. We have people from Baltimore. So if you'd like to join some of our Montgomery County chapter events, and you haven't already gotten on our mailing list, you can go ahead and, yeah, Lisa, is there a question? Okay. I thought you were raising your
just don't know
hand.
where the volume
I
is.
was just, I'm still hearing
She
a
was
lot of
talking about
background
leaving
noise.
it on those speakers.
Okay, so I can
Maybe
see
down here,
Don
but
Flesher, you're not muted. How about Mary McDonough also? You guys are not muted. Anybody else? You know, Russ, you actually have the ability to mute
I
people.
just don't know.
You can do that from being the host.
I thought we learned something this time.
I don't know if there's anybody else. Joanna, you're not
Is
muted.
this working?
It helps
No, I'm
everybody to
spending my time
hear.
on this one.
Muted everyone, but you need to unmute yourself. Lisa? Lisa?
Okay, now I'll mute myself. Now you can hear me too. Okay. Was I always on mute? No, it just went into that. Okay. Okay, so if you would like to join the Montgomery County chapter meetings, you can email, I'll put it in the chat in a minute, Hollis Goodman, and you can sign up for our mailing list and we'll send it out. Our next meeting is in May on the 21st. We get up in the morning, so it's at 10:30 a.m., not that late in the morning. And it runs for an hour and a half. And we also have CART because we think that's important too. Yes, Eastern time. We are not, that's not for the California folks. You have to get up really early. And yes, so our next meeting will be Dr. Gail Lynn. She's from Potomac Audiology, and she was a clinical audiologist and will be talking to us about hearing aid technology, what's happening with that. So you're welcome to join. And you can look on the HLAA website to see more chapters and what they're doing there, what everybody is doing on Zoom that you could join. Someday we'll be in person again, but I'm not sure exactly when that will be. The other thing I wanted to mention before I mute myself again is that the convention, the HLAA convention, is happening in Tampa, Florida. And that's going to be June 23rd to the 25th. There are still plenty of registrations open, but if you want to be on site, if you want to be have your hotel reservation on site, you have to do it soon because the hotel block is filling up. So we'd be happy to see everyone. It should be a good time. We have the research symposium and the exhibit hall and workshops, and I think we'll have a fun being there. So with that, I'm going to turn it back over to Judy. Is that correct?
Yes, thank you. I just unmuted. Can people hear me? I can override the super mute. Okay. Thank you very much, Lise. I appreciate your mentioning the convention in Tampa. The last couple of years when it's been virtual, let's just say it'll be so nice for folks to get together once again. I know we're all very anxious to hear today's speaker. Certainly the topic is top of mind. We're now into year 2+ of COVID variants, and it has had an impact on everyone, I'm sure. So Russ, why don't I, if I may, turn it over to you to introduce today's speaker. And you may also want to speak to the DC's chapter's next meeting next month in May. Thank you. I'm on mute again.
Thank you, Judy. Yes, the DC chapter will also hold another program in May. That will be the 22nd of May. That's a Sunday afternoon. And there will be a panel of DC government organizations, which will talk to us, about assistance and, and support that they can provide, for us in communications in the case of emergencies, whether man-made, natural, or personal emergencies. They'll talk about text to 911 and so forth. I think this one will be will probably not be of a lot of interest nationwide, but will be of interest, I think, to people, more locally situated. That will be the 22nd of May, 2 o'clock. It's a Sunday afternoon. Okay, let's get on to today's program. Our presenter for today is Crystal Scoresby. She works at the University of Tennessee, and with her colleagues there on a study is involved in a study on hearing loss, the pandemic, and mental health. She has about 17 years of direct experience as a licensed clinical social worker in a variety of settings, focusing on general mental health, grief and loss, trauma, and residential treatment. And without further ado, I'm going to turn this over, to Crystal. And Crystal, thank you for doing this for us. We much appreciate it.
Yeah, you bet. Thank you for that introduction. Can you hear my voice okay? Okay, wonderful. I am thrilled to be with you, and I just have to let you know that I have grown up with the HLAA. So my first meeting was at the age of 12 in a chapter in Hemet, California. And I gave my first presentation to that HLA chapter after doing a school project on hearing loss, probably around the age of 15. And I have worked with HLA ever since, on and off. But the advantage of growing up with it and knowing it was in its existence, as my needs have changed over the years, I knew where I could go to access resources and help. And so I appreciate just the history and knowing that HLAA is available for those of us with hearing loss to provide support at different points that we need it in our life. So I am going to share my screen, and I'm going to ask that that with questions, I'm so open to hearing all of your questions, of course, but when I am presenting, I can't see everybody. So there'll be certain points that I pause the presentation and stop sharing everybody. And that will allow me to be better responsive to questions. So if you wouldn't mind holding on to your question for one of those moments when I can pause and stop sharing the screen so that I can see you better, I would appreciate
I
it.
kind of liked it the other way better.
I'm sorry. All right, I don't think that was for me. So you should see my first screen here. Can everyone see that? Yes, okay. But I'm actually going to start backwards a little bit. So this is what I want you to think about as I'm presenting, is these two questions. Is when you cannot hear well, what are some of the thoughts that you have? For example, do you ever have thoughts like, why do I even try to communicate? Or the hearing world is not a place I belong in. Or I've let that person know that I have a hearing loss and they're still not speaking clearly. They are so rude. So I want you to be thinking about the kinds of thoughts you might have when you cannot hear well. And then what are some of the emotions that you experience? So for example, embarrassed, proud, humiliated, stressed, etc. So kind of have that be going on in the background of your mind. So we're going to be talking about hearing loss and mental health today. And my contact information is here if any of you want to reach out to me and ask questions or communicate with me. I would love that. So back to our agenda. So I'm going to share a little bit about my background with you, and we're going to talk about cognitive theory and negative mental health outcomes that are associated with hearing loss, and my research, which I'm biased, but I think is awesome. And then some tips on anxiety and why anxiety. We will get to that specifically about why I'm hitting that particular area of mental health, but it will all make sense as it unfolds. So now I am going to make sure I play here. Okay. So I'm just going to share a little bit about my own journey in the world of hearing loss. So I was diagnosed at the age of 4. My hearing loss is very genetic in my family, and my mom was specifically looking for it. So I started kindergarten at age 4, and she asked the school to test me. This was before testing was a requirement. So they caught it at age 4 as a mild hearing loss. At age 5, I started speech
Watch it on my
therapy.
computer.
I hated
Is
it.
she like this or like that? Which way is it?
You might have to remute everybody, Russ.
Over here?
Okay. I got my first pair of hearing aids at age 12, and then I promptly opened up my dresser drawer, put them in, and I didn't touch them because I didn't want to wear hearing aids. At age 13, I finally stopped speech therapy because I begged and begged and begged my parents and my speech therapist to be done, because it was so embarrassing to be constantly pulled out of class so that I could go do speech therapy. At age 16, I decided I didn't care anymore what other people thought about me, and opened up my dresser drawer and pulled out those hearing aids and put them on. And what's funny is that the hearing aids no longer fit me because I had grown by 4 years. And so they whistled all the time. They were little in the ear hearing aids, and they whistled. But once I put those on and realized that I had been missing out on sounds, I basically never took off devices again, because I very much value being part of the hearing world. So I continued to slowly lose until the age of 30, and I lost all the rest of my hearing. So we believe the hormones from pregnancy, my first pregnancy, that damaged all the rest of my hearing and took it off, took it away. And I fought for 4 years to get a cochlear implant, and had tremendous and horrific battle to get there, but I made it. So I received a cochlear implant at age 34. And at age 36, my middle child, my second child, my son, was diagnosed with hearing loss. And I cried for days, even though I am grateful for my own experiences with hearing loss and the place that I'm at right now. Knowing what was ahead for him just really devastated me. Are you all seeing, is it double captioning? No. Okay. Someone's saying yes. All right. Let me take off the captioning on my PowerPoint so that we're not double captioning here. Okay. So now you shouldn't see double captions anymore. Hopefully everyone can still see captions though. So this is my family, a little bit of my family tree. So this first column is my kids. So my daughter and my son, and then my youngest son. And then this next row over, or sorry, column is me and my brother. I have 2 brothers and a sister. And then it gets further in my family tree. Everyone here who's in blue has hearing loss. So it is so genetic in my family, and it's just something that has always been a part of my life. However, once family members lose hearing to the point where they're not able to work, they usually stop working and withdraw from life, basically. So most of my family members have, I'm the first to get a cochlear implant. So I've been a pioneer in the family. And since then, I've had my implant now for 10 years. And since then, a couple of other family members have gotten a cochlear implant, which has been very exciting. But growing up, I thought it was just to be expected that once my hearing was to the point where I could no longer function, then that was kind of it. But thankfully, I live in an age, and I've grown up in an age where technology gets better and better and better. And so that wasn't it. that wasn't end of life, right? Or end of my story. My story has continued, and I've done some really amazing and incredible things because of access to technology. And I cannot even express how grateful I am. So one of those things I've been able to do is my career. So my first college major was elementary education. And it wasn't for me. The more I started getting into classes where I started teaching, I became very fearful that I would not be able to hear children in the classroom. And so I changed my major to social work. And so I got my bachelor's of social work in 2001, because that felt like it was a much more manageable career for me to have. And I went straight to get my master's in 2003 and became a clinical licensed social worker so that I could treat mental health issues. My first career opportunity was working with adults that had learning disabilities and autism spectrum disorders. And this job was challenging because these individuals, some of them, their disabilities were pretty severe and it impacted their speech. And as I'm losing more and more hearing, my ability to understand speech gets worse, right? And so it was really a struggle to understand these individuals. So I ended up changing career tracks. So in social work, it's a great field to be in because there's so many different populations you can work with and so many different things you could do. So I switched tracks and went to adoption work, and then became challenged by all the phone work that was involved. So we would need to talk with attorneys and other caseworkers as we coordinated cases. And, I would go to court and need to provide my supervision reports on children who had been adopted. And my hearing was just such a challenge in those situations. To captions, this was before Bluetooth technology helped us and all of the other things that have happened technology-wise the past few years. So I, again, changed tracks and I just did individual and marriage counseling in my office because I could control the environment and it was quiet. But as my hearing worsened and then I lost it all, I would use the most powerful hearing aids I could find with all the assistive listening technology I could use. And I would put these microphones from these assistive listening devices in the faces almost of the people I was counseling because I wanted to hear them and it was such a struggle. It actually got to the point where it was no longer something that I would be able to do and that it wasn't fair for my clients if I was not hearing them clearly. However, I had some really great supervisors and they pretty much said, we will take you however you come and we will do anything to make this work. And all my clients knew walking in that I have hearing loss and it's not something that I could hide. And so I would explain to them about all the accommodations that I would need and that that could get in the way in mental health treatment of other people, which counseling sessions are supposed to focus on the needs of the client, not the needs of the therapist. And that I could focus on them and their needs if these accommodations were met so that I could hear them. So I gave them plenty of opportunity to say, this isn't something I can work with right now. And I didn't take any personal offense because people come into my office with trauma and difficult situations. And some of them are not able to accommodate me. That's not on them. But I found that almost everybody loved that not only I understood hardship, but I was open about hardship. So they felt like the playing field had been more equal. And happy to work with whatever set of accommodations I needed. So that was a gift that I had that and that I had chosen this field and that it worked, even though so many different things were impacted for me. But then I got my cochlear. So these different issues in Black that have come up impacted my career, but then I got my cochlear implant and the ceiling broke for me. Everything changed. My entire life changed once I got that cochlear implant and I went through all the rehabilitation. So I'm completely an overachiever. I will be the first to admit it. And I spent hours on my rehabilitation, 3 hours a day, every day for 3 months. I never stopped so that I could hear speech. That was so important to me. But once I did and started to hear really well, I felt like the ceiling broke for me. And I realized there's like, what are my dreams? I can dream again, right? And so some incidents or some events occurred that led me to want to go back to school and get my PhD. And so what's fun about this story is that I'm teaching. I wanted to do in college was to teach. I'm now teaching, but I'm teaching other social workers and therapists how to be therapists. So full circle, I am teaching, but now on a college level. And I will complete my PhD this next year. And so we'll soon be applying for a faculty position, but also maintain my private practice. So that's career-wise. So you know where. So we're going to hit on cognitive theory because this is very, very well researched and very effective in working with mental health issues. But even more than that, I chose this theory to talk about because so much research on mental health and hearing loss, which unfortunately is not as much research as I want to see, but most of the research out there that talks about hearing loss and mental health recommends cognitive theory as a treatment approach for those with hearing loss. So I thought it was important that we talk about it. So I'm going to go over this pause so that if there's any comments or questions, we can address those. So cognitive theory basically states that our cognition, which is our thoughts, create feelings, and that those feelings lead to behaviors, and that the behaviors reinforce the thoughts. And it's this cycle that happens again and again and again and again over the course of our lifetime to develop what's called cognitive schemas and core beliefs. And those core beliefs become deeply embedded in who we are as people. And when those thoughts are negative or self-critical, then our feelings are going to be pretty down, pretty negative, pretty difficult. And then we participate in behavior that supports those thoughts or feelings. For example, withdrawal, out of bed, or not going for that promotion, or not going to that activity. So we do things behavior-wise that reinforces those thoughts and feelings. So when this pattern happens again and again and again, we have poorer outcomes. We have lower quality of life, we have lower self-esteem, and we have less happiness. So the next slide, we'll talk about cognitive theory and hearing loss. So how hearing loss specifically can be fit into the cognitive theory, but I'm going to pause for a second and stop sharing to see if there are any questions or comments so far. And if not, it's okay. I just want to give you the opportunity. Yeah. Is it Zoe? You're on, yeah, you'll need to unmute.
Okay, I find it. Yeah, I can relate. There's so many activities that I've been trying to get into. And I just feel like I like to be really active. So I like to play mahjong, I do pickleball, it's a lot of activities. But I feel like when I try to a bunch of people and start talking, it's almost like I'm not included because they kind of know that I can't really hear everything that they say. So I can relate, what you're saying about lower esteem and the quality of life and stuff. But for the most part, I have a pretty good attitude. I just like, okay, whatever. I'm just going to keep going, keep trying. But good news is I had cochlear in both ears. But I'm looking forward to getting a new, I don't know if it's okay to talk about an upgrade of cochlear that I'm going to be getting. And it's supposed to be a lot better for hearing speech. So, but anyway, I always try to be on the look on the bright side of everything. Anyway, I really appreciate everything that you're saying. It's really good to hear that.
Thank you for that comment, Zoe. I feel like if we did a poll and we asked, can anyone relate to feeling left out in social conversations? Wouldn't we all like raise our hands? Yes, yeah. Right. Where we all know that feeling of feeling like you're not, I have a hearing loss, but you're not including me in this group, despite all my effort and work. I think we can all relate to this. And this is, I believe, is the number one factor. These communication challenges, it separates us from people, and it separates us from making meaning with those people. And that can damage our mental health. Yeah. So thank you for that comment. And I'm gonna move on to the next slide unless there's any others. I don't see any. Okay. Let me share my screen again. Okay. So cognitive theory and hearing loss. Just like the example Zoe gave us, it is so easy to have these kinds of thoughts. I knew, oh, I spelled that. There's a typo, sorry. I knew if I came to this dinner, I would just feel left out. Likely something like loneliness. What's the behavior? To draw inward. To maybe push, even move my chair back. Or maybe to not talk or not do the tennis match, right? Like we do, trying to like pay attention to who's saying what. We just stop, and withdraw a little bit. And then let's say the next thought is, no one even noticed that I stopped participating in this conversation. Then what's the feeling? Likely rejection or something like that. So that's one, what's our behavior? Maybe we continue in that conversation to avoid participating. Maybe we get up and leave, don't say goodbye to anybody. Maybe, we are aggressive and say, hey, you all are being rude and you're leaving me out and I don't like it and I'm not going to come and participate anymore. Or not, or we just don't show up for the next dinner with friends or whatever is going on. So one pattern is not enough to cause a mental health issue. But if it happens again and again and again and again and again, can it contribute to developing a mental health issue? Absolutely. Absolutely. Once this pattern continues over and over, we start to experience what's called triggers. And then we get triggered easier and easier and easier, sensitive to triggers. So maybe the next time we withdraw even earlier in the conversation, or we just stop going out to dinner with friends or doing another activity. Eventually, maybe the thought of even having dinner, not even committing to going, but even the thought of going out with friends starts to fill you with stress or anxiety or discomfort or where even the thought of it, like it's not even happening, you're not in the current situation, but just the thought of it puts your brain in that space where you're feeling as stressed or as anxious as if you were in that experience. That's a trigger. And so we're back to this cycle, but now we've included the trigger in it. So now we have our trigger. We have our emotions. We have our behavior. And again, it cycles, again and again and again. So when that cycles, what can happen? So well vouched for in the literature. These are the things that happen. Low self-esteem, anxiety, depression, suicidal ideation. Now I'm going to pause here for a second because I want to explain what suicidal ideation means. It doesn't mean you're going to go kill yourself if you have suicidal ideation. Ideation means you're having suicidal thoughts. Our frustrations with hearing loss, our communication challenges can become so stressful and impact our relationships so much that it can lead us to have a suicidal thought like, why am I even here? What's the purpose of me to be here? And that's suicidal ideation. Now, it becomes a threat, it becomes dangerous when it leads to developing a plan. So if you find yourself in the position where you're not only having thoughts about not being here, thoughts about dying, and I'm not talking about end of life dying, where you know that that's inevitable. I'm talking about wanting your life to end right now because the stressors in your life are too high. If you start to think about a plan, like I would do it this way. So you start to think about how you would take your life. That's when you are not safe and you need to have intervention. So I just wanted to point that out. So we know the difference between suicidal ideation and a suicidal plan and the danger differences between those two. In the place of suicidal ideation, it's not a good place to be. It's really stressful. But when that plan comes, that's when it's dangerous, and you need to have intervention. And if you hear anyone in your family or friends or network have a plan, then you need to take them to the hospital. You need to get a counselor involved. You need to text the crisis hotline, et cetera, to make sure intervention happens for those individuals. So I'm gonna pause again. I'm gonna stop sharing to see if there's any questions on any of that. Okay. And of course, we'll have time at the end if you have any questions or thoughts that you would like to share. So going back to my PowerPoint here. So these cycles of behaviors from thoughts and feelings can lead to any of these things. And it's not the only things that it can cause. Other mental health outcomes that are associated with hearing loss are substance use, not necessarily more substance use or different substances than what hearing people use, but when those with hearing loss are using substances, they tend to be heavier users. For example, be heavier drinkers. So maybe not drinking more often, but drink a lot more in a period of time. That has been a mental health. Paranoid thoughts can develop. Will I hear? What if I can't hear? What if they make fun of me because I can't hear? What if they don't accept me because I can't hear? What if I go into this situation and then it's embarrassing because people can't hear? Like we start to feel a little paranoid about these situations. We can ruminate where we're thinking the same thought over and over and over again. Like, I can't hear this. Or I'm just going to go and I'm going to sit in a corner and I'm going to have to pretend to participate. Or we all know that we're all really good at faking, right? This is like so established. Those of us with hearing loss, when we've had hearing loss for a while, we know how to fake it through conversations. And we can give that fake smile where we're like, I don't know what you're saying, but I'm going to nod my head anyways, right? And those can where we're thinking the same maladaptive thought over and over again. Hearing loss is also associated with psychosocial stressors like lower education levels, which can cause lower job security or lower annual income. It's associated with food insecurity. It's associated with abuse, both being a victim of abuse and perpetrating abuse. So these are all the, not all, many of the mental health outcomes that are associated with hearing loss. But kind of field any benefits. Is there anything good that comes with hearing loss? Of course there is. It's not a hopeless situation, right? So those who successfully use hearing aids or cochlear implants or other devices, or those who are culturally deaf and use sign language and are well connected into their communities, they're more likely to report a higher quality of life and more social interaction that's meaningful. People with hearing loss are able to be really focused. I tell you what, I'm working on my dissertation right now, and when I have to write a lot, I don't want to hear anything because it's distracting to me. You know, I'm in East Tennessee right now, and the birds here are incredible, and I'm so grateful I can hear the birds. But when I'm typing my dissertation, I don't want to hear the birds. You know, I don't want to hear my children running up and down the stairs. I take my ears off and I get it done. Like, I can focus so well. That can work to our favor sometimes. We can be really present because we have to be. So if I'm listening with everything I am to you. That allows me to do. So I chose a great field because hearing loss has caused me to be an amazing listener. And when I'm listening to you, I'm not just hearing your story. I'm hearing and seeing all the cues, all the nonverbal. So if you're my client and telling me something really hard, but you're laughing or smiling through it, I'm gonna pick up, even if it's subtle, I'm gonna pick up the dichotomy of that and what that means, and probably the discomfort you're experiencing as you're sharing your story. I'm gonna pick those things up much quicker than my hearing counterparts. So there's a lot of advantages and benefits to having a hearing loss. And again, I'm gonna pause right here. So some of these things are in the research, what the literature says, but I just wanted to give you a moment and ask, what do you see as a benefit to having hearing loss? Do you see any or experience any that I didn't mention?
Comment on that. One question and one comment. First of all, when you say a higher quality of life, are you referring to relative to others or relative to the situation before, you know, when you didn't have the interventions or the technology? So I'm not sure what higher relative, you know, is this longitudinal, or is this, I mean, you're comparing yourself to people who don't have hearing loss and are saying they're higher quality of life, you know, relative to them?
Yeah, thank you for that question. And I didn't think of explaining that because I'm so used to using this language that sometimes I forget. So thank you. So quality of life, we know, refers to how much we're able to enjoy our life. And there are so many measures used to measure how we feel, how much joy we're getting out of our life. And it focuses on how we participate in things and how much meaning we get from living the lives that we live. So that's quality of life. And then when I say higher quality of life, that those with hearing loss, when they're measured, when they use those scales and they fill out those standardized measures, those with hearing loss report lower levels of quality of life without hearing loss. However, those who receive intervention with their hearing loss and they use them, those who are using hearing aids successfully, those who are using sign language successfully or cochlear implants successfully, they report having higher levels of quality of life than those who are not treating their hearing loss. Does that answer your question?
Yes, it does. I'll make one other, and this is more of a comment. When you're saying, you know, we become great listeners. And I think that's certainly the case. At the same time, I have to say, it's really hard. I mean, it's yes, we may do very well at it, but it's totally exhausting. You know?
I absolutely agree. And as a matter of fact, before I got my hearing loss, I went from being able to see before I lost all my hearing, I went from being able to see 20, 30 clients in a week to 5. I couldn't do more than 5 because it was just too exhausting and it took too much out of me until getting my cochlear implant, you know, and then I was able to build that back up again. But yes, I agree. Hearing is exhausting. It's exhausting. Even when you're hearing well with devices, it is still exhausting. So Viola, did you have a question or a comment? Can you unmute? You're still muted.
Thank you. I'm my hearing 50s, but it progressed very quickly and progressed so quickly that in not many years, hearing aids were useless to me. Unfortunately, I went quite a long time before I considered a cochlear implant, but I was implanted a year ago, January, and I have to say that completely has changed my life. It is so much easier now to reintegrate into the hearing community and my family because you know we all know the struggle, the fight, the daily exhaustion of just trying to hear and stay engaged. And my CIs helped me so much with that. So I do appreciate the technology and all that. However, I have to tell you that in school, my hearing loss has been a gift because it has brought me this community, this organization, and an awesome group of friends who share my journey. And when we moved here from Pennsylvania 4 years ago, not much of a hearing loss community at all. When I moved to this area, I was stunned at the number of people I saw walking around, signing, wearing cochlear implants, seeing hearing aids. I was just like, wow. And as I realized, probably a lot of that's due to Gallaudet, I don't know. But through this organization, I have met some awesome people. And I don't know that I would go back to being hearing if it meant I wouldn't get to know them. They are just so supportive and so wonderful. I'm just so that to me is a positive. It's an absolute positive.
I love that. Thank you for sharing that comment. We make meaning. We have developed that adds joy to our life, right? I mean, I don't know any of you, but I automatically feel connected to you because I know we're on the same journey of hearing loss and we can relate to each other in so many ways. So it's automatically this connection point. And that's a gift, I agree. So thank you for that comment.
Oh, you're welcome.
And it looks like we've got some chat messages. So let me check in on those. Dana, your name is very familiar. I think you've worked with the DC chapter, maybe. Or the national chapter. I know your name, I don't know why. But it looks like, yes, one of the wonderful benefits of HLAA is being able to get different perspectives, on how we can interact and respond to hearing loss. I've gained so much knowledge from interacting with others with hearing loss and learning about different ways of hearing better in difficult situations. And yes, also about ableist and discriminatory attitudes and behavior. Yeah, and part of my dissertation work is also looking at not what we need to be doing different as people, but what society needs to be doing differently for us. And then Heidi had a comment. Yeah. So through lip reading and hear that app. So I don't use that app, but that sounds amazing. That you were able to have that successful conversation. And Rachel also valuing HLA and community support. Yeah, love all of those comments. Thank you. A benefit. Knowing that you're not alone on the journey, and that there's others who can relate to you, but there's also others who've gone before you and help give you tips or advice or different scenarios. It was people that I have hearing loss when I started teaching in the college classroom, where I reached out to people who had hearing loss, and I said, I want to know about the accommodations you use as an instructor. I got the whole student thing down, but as an instructor, you've gone on before me. Help me know what you do. So that we can utilize all of this great work. So it looks like we have a comment by, I'm sorry, I can't tell what your name is. Burke? Yeah, can you unmute?
I wanted to follow up what you were saying about enjoying silence. I have, I think, compared to some others here, relatively minor hearing loss, quite easily dealt with a hearing aid. I live alone, and I prefer to spend most of my time without putting my hearing aids in, including sometimes when I'm out about in the world, and I live right downtown and I find the world very noisy. But doctors and others kind of push me to say, you should keep the hearing aid in all the time. It's important for your brain function and learning and other reasons. Would you care to comment on that for those of us? I mean, I put it in when I go to a meeting or when I'm with a group of people, but other than that, I kind of prefer the lower level of noise.
You know, there's a lot of discussion on that in the literature. So for someone like me, I'm very busy and I'm very involved in communication and humans, and I'm raising humans currently and working on my PhD, and I'm seeing clients. Like, I have to hear for 16 hours a day. I have to, like, I don't have any option. But I prefer it. If I have a Saturday where I don't have to hear anyone, I prefer to hear, except for when I need to focus, then I take my ears off. But this is what the literature says. The literature says that you do better in the hearing situations you do go into if you're wearing your hearing aids, even in non-situations where you don't have to communicate or hear, because it does train the brain. But I also think it's a matter of preference. And I don't think anyone can tell you how often to wear your hearing aid or not. You get to decide. And Viola, it looks like, did you have another comment? No, okay. Roslyn.
Yes, somebody was mentioning, I think it was Dana, asking if we heard a crackling noise. And I was hearing that with some you, and I'm depending on reading the captions. And I wanted to bring up another point, and maybe you'll be getting to it later, what is considered a mild hearing loss, but I have difficulty in processing the words. So if someone talks quickly, I can't really process what they're saying, and perhaps you'll get to that later. I don't know if that's something you're going to cover in this discussion.
No, I haven't covered that yet. Am I speaking too fast?
I'm still hearing the crackling noise.
Yeah, I don't know what the crackling noise is. I'm sorry. So it looks like others said no, I wasn't speaking too fast. Okay, if I start to speak too fast, please let me know and I'll slow down. And I hope the crackling noise goes away. I don't know what that's about. Funny how we always have to have, even with the technology we're very grateful for, there's always problems with it too. Okay, so I'm going to share my screen again. Okay, so to having hearing loss. But these stressful listening situations can take over our brain, and that good stuff, the things that we value, can fly out the window, and our brain can be hijacked, so that we feel a lot of distress and we feel really limited. So the World Health Organization, the way that it defines disability is really interesting. It's not whether a person has the condition or not, or has a disorder or not, but that's not disability. That it's when a person has, they feel like their life is impacted. That is what defines a disability according to the World Health Organization. And there are times in my life that I do not feel disabled, and there are times disabled because of my hearing loss. And one of those times is coming up. I want to introduce to you my research that came about because of this. So when you look at this screen, I'm not going to ask you to tell me, but does anyone start to feel stress? These masked individuals, does this cause stress for anybody? For me, with how well I'm hearing, interacting with people in the pandemic, very stressful experience. But I was fortunate, and everything shut down, and I got to work from home and did most things virtually. So I wasn't in it all day, every day. But the times I was in it, the times I did have to interact with people who were wearing masks, it was stressful. And I found going into these situations that I had to gear up to prepare myself psychologically for going in to this. However, I belong to all kinds of hearing loss groups. I know lots of people with hearing loss. And some of my support groups on Facebook, that conversations kept coming up over and over again about how stressed out people were because of masking. And they were people who had to continue to work day in and day out with those who were masked. So it wasn't just like, I have to go to the grocery store and deal with a clerk in a mask. It was, all my coworkers are masked, or all the patients I see in my office, or, you know, I'm an essential worker and I have to be at this place. And everybody's wearing a mask. So what I saw was stress, totally understandable. What I saw was a rise in suicidal ideation. What I saw was a rise in not just anxiety, without having generalized anxiety disorder. What I saw was a rise in symptoms that could mean they had generalized anxiety disorder. So that this masking experience wasn't just a stressful situation, it was actually causing disorders. It was actually causing mental health issues to be so significant that people were thinking about taking their lives because of the stress of having to endure masking. So I was a college student at this time. I was back in, it was still during my first year of my PhD program. I had gone in the second semester, pandemic hit, we were all sent home. I moved my family across the country to do this program. And then all of a sudden I'm working on my program from a little corner in my bedroom as we stopped going to campus, and my program was closed for 2 years. It's this semester, it's the first semester I've been back on campus. But the things that I saw in my social circles of those with hearing loss, I became very concerned about. My dissertation was not initially going to be about this. I specialize in grief and loss, and my dissertation was going to be about grief and loss. But when I started to see the risk of those of us with hearing loss, I looked around to see who was studying it. Like who's taking care of the people with hearing loss during this pandemic? Who's considering the needs of people with hearing loss? And yes, there are so many life decisions that had to be made, so many policies that had to be determined and put in place. but who's considering people with hearing loss and studying it and making sure that they're okay? Who's doing that? And I couldn't find any research or any researchers who were doing it. There were some, articles that would pop up here and there, but not in the research. And we use research to inform policy. So if research is not being done, how is policy going to be informed if we don't have it? So that's when I decided I have to study this. If I'm not going to do it, who is, right? Dissertation. So it was sparked by the trends that I saw in my hearing loss communities. Saw communication, how levels of distress there were, how those high levels of distress were leading to such significant mental health issues and suicidal thoughts, and why. So I put the definition of crisis here because it's really important. If our current coping skills are not sufficient to manage our current stressors, we are in crisis. So it doesn't mean some big event has to happen to us. It can be little things. It can be chronic daily things that happen, or it can be a big event to where we don't feel like we have the adequate coping skills anymore to deal with those current stressors. And if that's our experience, we're in crisis. So why did masking cause more mental health issues and more suicidal thoughts? Because people went in crisis. And it was crisis that was made more complicated by cutting off social connections, by not having a lot of good, reliable information. There was a lot of fear that was coming out, and a lot of scary things happening. And so that put a lot of people in crisis. Ongoing crisis, the pandemic hasn't been solved quickly. It wasn't over with. Like, my kids went home for spring break and they never went back to school ever. And the first email we got was, in 2 weeks, we'll go back to school when things have calmed down. Like, how naive we all thought we were that after 2 weeks, things would calm down in the pandemic. Yeah, that has not happened. So this ongoing crisis has led to mental health distress among those with hearing loss. So I got IRB approval, which is the governing body that allows you to do research with human subjects. And it took months and months to get that study approved before I can even recruit, because they were concerned that people with hearing loss are already vulnerable, and that my study could make them more vulnerable by me asking difficult questions about mental health. So I did go through a lot of different hoops to just get the study approved, and to make sure that that people that I was gathering information from were safe, and that they had resources in place. So I used 3 different recruitment places. I sent my survey out to my personal and professional connections in the world of hearing loss. I sent the survey out to the issues arise in, and we sent the survey out to patients of the audiology clinic here in East Tennessee, at the Health Science Center at the University of Tennessee. What came back? I have 170 people who participated in a very short window of time. It was a 4-week window of time that the survey was open for. So here's the demographics. So if these demographics feel similar to you, or maybe not at all, but this is the demographics of my survey, that 20% of my participants were between the ages of 18 and 34. All of them have hearing loss, by the way. Everyone in my sample has hearing loss. 30% were between the ages of 35 and 54, and 50% were 55 or older. 66% female, 87% white, Caucasian, 57% were married at the time of my survey. And the education level, I thought this was super interesting because research shows that those with hearing loss have less education. Educated. So 30% have a bachelor's degree, 26% have a graduate degree beyond the bachelor's, 11% had some college or technical certificate, and 10% were high school graduate. And I did have a few that had dropped out of high school. But for the most part, they were college educated. So those are the demographics. Hang on, before I share the results, let me pause to see if there's any questions. Hopefully you're following along with what I'm saying okay, and that it's clear. Let me check in on the comments. So the crackling noise is gone now. Okay, that's good. And Dana commented, I felt so much more disabled during the pandemic because of not being able to lip read people. Yes, same for me. And you know, it's interesting. When I can't hear, what do? I lean in, right? Do the rest of you do that? Lean in. Oh my gosh, people freak out. Get away from me, right? Accommodations that we normally use were like gone. And live transcribe on your phone. Some healthcare providers reduce their communication with you. Yes, it does help when they use those masks that have the clear window. You know, what's interesting with those too is that they disrupt the speech signal even more than just like a cloth mask. But yes, like you want access to the face. Like we want to be able to see the face on yours. And that's unfortunate that your eye doctor never got it, even though you requested it. That's really unfortunate. And yeah, I agree. Even when we're assertive and we provide information and educate and actively accommodate and we're loud about our needs, people can still discriminate against us or don't see the need. Or they just yell, right? Or do something else that's not very helpful. Thank you for sharing those things. Okay. Any other comments on that or questions before that? Okay. Oops.
I saw a doctor very recently, and he tried to be as accommodating as possible. He was wearing a full mask. He spoke very slowly, and with my CI, I got a good bit of what he said. I brought my husband in with me. However, he shared something I wasn't aware of. I guess it makes sense. He said some doctors won't use the see-through because they're not CN95. And they just feel they see enough people who might be seriously compromised that not only for themselves, but they might actually be putting patients at risk. So he did try to explain why he would not use the see-through mask.
Yeah, and I'm glad that he tried. And yes, I heard that a lot also. You know, this is my personal solution. I feel like every single health provider across the country should have a captioning device that's next to them, and that everything they're saying, we can read right next to it, like a TV, right? You can turn the captions on any TV you want now. Why is that not in medical offices? With the technology we have, I do not understand. Even if they can't wear a clear mask, why can they not carry personal devices? We have to do all the work, right? I have captioning apps on my phone, and I will constantly, I'm like looking up and down like at my phone and at the person I'm talking to sometimes. It'd be easier if they just carried it with them. So that's my solution to the masking issue. Doctors can be asked to pay for real-time captioning if they want to see a see-through mask. Yes. Yeah, I agree with that. They can do that too. Okay. So let me go back to share my results with you, which I think are fascinating. So what has COVID-19 pandemic done to those with hearing loss because of these communication barriers? So we know communication burden increases anxiety and it decreases quality of life. Of my sample, 83% indicated that it is moderately more difficult, severely more difficult, or impossible to hear anyone wearing a mask. Now I know to all of you, you're like, well, yeah, that's totally obvious. that it wasn't in the research. And if it's not in the research, policies don't get developed. So I have to be so clear and make it so obvious when I publish these results that there can be no question that these were communication barriers for us. 58% indicated moderate, severe, or unbearable distress in mass communication. Not just stress. Moderate, severe, or unbearable. That's a lot of distress because of a mask, right? Okay, now this is a really important finding in my study. The GAD2, let me explain this, is an anxiety screener. It's just a 2-question survey. Depending on how you answer and how it's scored, if you get a score of 3 or higher, it means that you're not at risk of having temporary anxiety. You're at risk of having generalized anxiety disorder, the actual disorder. So these are the questions. Over the last 2 weeks, you've been bothered by the following problems, and you give a response that's a scale of these 4 things. Not at all, several days, more than half the days, nearly every day. So over the last 2 weeks, how often have you been bothered by the following problems? And the following problem number 1 is feeling nervous, anxious, or on edge. Problem number 2, not being able to stop or control worrying. So added together, if the score is 3 or higher, you are more highly likely to have generalized anxiety disorder. So it's considered a screener for the mental health issue of anxiety. So this is what the results were, but to put it into context, let me explain. Before the pandemic, a year before, in 2019, the general public was sampled with the GAD2 screener. The general public sample scored 3 or higher. So 8% of the general public in 2019 screened positively for having generalized anxiety disorder. A year later, in the pandemic, in April, May 2020, so had been in place a couple months, 31% of the general public scored 3 or higher. So it went way up, right? And it makes sense. Pandemic has been scary. So 31% met criteria for generalized anxiety disorder. What about my folks in my survey? 1 year later, so the pandemic's been in place almost a year now, February, March of 2021, 42% of my sample have a score of 3 or higher. 42% of the folks who took my survey screened for generalized anxiety disorder. That is a huge number. That is a huge increase from 31%. It might not feel like a big increase, but statistically, when you look at that, that's a lot of people. So this is why I talk about anxiety at the end, because my had very high rates of anxiety, and we need to treat that. We need to talk about anxiety and what to do about it, because there's so many things you can do about it, but we get stuck in it. So this is the second one I wanted to point out. The PHQ-2 is the other screener I use, and that screens for depression. So same thing, if you score 3 or more on this screener, you are more likely to have not just temporary depression, but major depression disorder. So over the last 2 weeks, how often have you been? Problem 1, little interest or pleasure in doing things. Problem 2, feeling down, depressed, or hopeless. And you answer those based on several days, more than half the days, nearly every day. Gets a score of 0. Several days gets a score of 1. More than half the days gets a score of 2. Nearly every day gets a score of 3. So you add those 2 up, and then based on the score, we know what major depression disorder is. And this is a fascinating finding. Are you ready for this? Going back to 2019, general public, almost 7% of the general public sample scored 3 or higher at meeting the criteria or the screener for having major depression disorder, 6%. April, May 2020, 23.5% of general public scored 3 or higher for major depression disorder. You ready for my number? Have you on edge, I know. 22%. 22% have a score of 3 or higher, February, March 2021, lower than the general population during the pandemic. So I'm going to pause my screen again real quick. So that means anxiety, higher, lower. Why do you think, just if you could guess, why do you think those with hearing loss had a little bit lower of a depression rate, but much higher anxiety rate? Any guesses? Yeah, Heidi.
I think we're more resilient and used to being alone.
Heidi. And Noreen says avoidance. Yeah. So communications reduced in the pandemic. Our interaction with other human beings reduced, right? Heck, when we have to go communicate with people, but we're communicating with people less. And so even though usually those two things are tied together really well, depression was lower. And Heidi, I agree with you. People with hearing loss are very resilient. I did a resilience screening also in my dissertations. And yes, are off the chart resilient because we have years, often years of experience condition and having to force to be resilient to it, right? And we have years of experience of accommodating for ourselves, but the pandemic brought us back to the level of disability with communication. So it makes sense that anxiety got so high, but depression didn't jump also. Yeah, okay. So what do we do about anxiety? That's what I want to talk about. So the anxiety tips is how I'm going to finish and wrap us up. Do question and answers at the end if you have any. So I'm not going to go over every single aspect of this. I put it in detail on purpose so that you could, we'll send you the PowerPoint and you can read through it and refer back to it or use it for whatever purposes. But I just wanted to give you a heads up. Even though I love providing tips and I am a licensed therapist, what I'm saying today does not replace them. So if you find yourself in a place of psychological distress, please consider going to counseling. Don't use these tips only as the medical advice that you need. I am biased, I know, but I think therapy is awesome, usually. So please consider going to therapy yourself. So tip number 1 is to keep a thought record. Now, I explained cognitive theory at the beginning, right? That our thoughts and our feelings and our behaviors all contribute to how our mental health does, to how mentally healthy we are. So what do we do about it? When we're having maladaptive thoughts, we have to track them first. We have to identify what thoughts are causing us problems. So if you keep a thought record like this for a period of 2 weeks, you'll have a much better idea of what's going on up here. Most of us do not think about our thinking. And this kind of work, when we're treating our mental health, we have to. We can't afford not to think about the way we're thinking. So this makes our thoughts conscious and aware. That's what we're trying to do. So you would write down the date, the situation, what your thought is, what your feeling is, what your behavior is. A lot of people confuse thought and feeling. Thought means what's happening in your brain that the dog is barking. I hope she doesn't interrupt this presentation. That's a thought. The feeling, stress. So that's not the thought. The dog is barking is not a feeling. The feeling is stress. So it's usually that one word emotion we're looking for. Anger, frustration, disappointment, rejection, stress. That's the feeling. And then of course the behavior. So I'm going to give you a sample one. This happened last night. This was a real one. Last night, here's my situation. I'm watching my son's baseball game. I noticed an acquaintance sit a couple of chairs over. Here's my thought. I hope they don't talk to me. I can't watch my son's game and talk to someone at the same time. I am not a good multitasker, especially if it comes to listening. So I don't want to talk to them. I'm like disappointed that there's an acquaintance that's sitting down a couple of seats over, right? So what's my feeling? A little discomfort, a little fear that they're going to try to talk to me. So what's my behavior? I pretend like I don't know them. I just look straight ahead, right? I see you're smiling because I know y'all can relate to this, but I pretend like I don't know them throughout the game. After the game, lying down, I approached them and said, a pleasant conversation. Here's my thought. It's okay that I didn't try to talk with them during the game. They were nice after the game. It all worked out. My feeling, I felt relief. My behavior, I responded positively when I saw them again just before leaving. End of story. It was over. So this is what we don't think about our thinking like this and spell it out. This is what I would want you to do. I want you to track your cycles, your cognitive cycles for 2 weeks and start to look for patterns that come up in your cycles. So after collecting the data, you ask yourself the kinds of questions like, what kind of thoughts am I having maybe repeatedly? Or what kinds of thoughts lead to negative emotions or lead to distress in me? What kinds of situations am I experiencing that are triggering? What kinds of behaviors happen with critical or negative thoughts or emotions? So you want to ask yourself these questions. And then you alter the thought. You take, because now you know what your thought is. You're getting better at recognizing your thought. You alter the thought. Changing the thought is what cognitive theory is based on. You change the thought, it changes the feeling, it changes the behavior. You're in a better psychologically, or a better place psychologically. So thinking about your thinking is key. And most of our thoughts are so automatic, we don't think about it. So you create a neutral thought. Here's an example. Instead of, I know myself and I had the thought, I hope they don't talk to me. Game at the same time. I can change that in the moment. I prefer to focus on my son's game for now, but maybe I'll talk to them after. Why is this different? I've neutralized it. It's no longer about what I can't do. It's no longer about avoiding them. It's no longer about, oh no, this is a problem. It's now neutralized. I'm choosing to focus on my son's game. I'll talk to them later. Non-issue, right? Or I'm not expected to talk to anyone right now. If they try to talk to me, I explain I want to focus on the game and then I'll talk with them after. So you want to replace the thought. Now, how does that make a change? Let's say that here's my thought. Same situation, my thought's the same, everything's the same in what I just shared, except now I have a replacement thought. I prefer to focus on my son's game. The second line, I'm using that replacement thought as my thought. I prefer to focus on my son's game for now, but maybe I'll talk to them after. Now my feeling is neutral. I don't feel anything, but I reattune into my son's game without being stressed or worried about social conversations. The stress is gone from my situation. So my behavior, I no longer think about it. It's over in my head. I don't have to think about it anymore. I can just watch the game and I don't need a replacement thought because I'm already in a better place. Now, this is a very simple, very silly example on a situation that really doesn't matter. But if you can do it on simple situations, then it's easier to do on more complicated. So I would encourage you to try this for thought replacement on simpler situations and just notice, does it cause a change Does it cause a change in feelings, in emotion? Does it, which causes a change in behavior? If it doesn't cause a change for you, then try to use a simpler situation in which maybe the trigger is not so hard, or maybe the feeling's not so intense, so that you can practice this, because it does change the feeling, if that makes sense. Okay, I'm going to pause here to see if there's any questions before I give my next tip. I feel like I'm talking fast. I hope I haven't lost you. We okay? We're okay. Okay. Wendy, I sent a copy of my PowerPoint to Russ, and he'll be emailing it out to everybody after the meeting with the recording link, I believe, so that you can access this information. Yeah. Yeah, I'd love for you to try this out, because I think it's so powerful. This is one of the major modalities I teach my students who are becoming therapists, to understand cognitive theory and the impact it has on us psychologically, to be able to just alter our thoughts, and then the cycles can change. It doesn't change the system and an ableist system or a discriminatory system. It doesn't do that, but it helps put us in a better place, so it's not leading to generalized anxiety disorder or depression. Maybe it's causing stress, but it's not leading to a severe disorder that impacts all these areas. Okay. I know this is so fun for you, so I'm going okay, next tip. If you're feeling anxious, you absolutely should be thinking about your breathing. When we start to get stressed, what happens to our breathing? We stop breathing from our gut. We start breathing too shallow from our chest. And that sends a message directly to the brain that says, a bear is coming after you, run. Be in threat. You're in danger. This is a problem. When our breathing gets shallow, our entire system is built to go into fight, flight, freeze, right? So once our system has been activated, where we're only going to fight, flight, or freeze, that means our logical ability of our brain, all of that, like great experience and wisdom you've developed over the years, gone. And you go into this stress and panic mode. So paying attention to your breathing and changing your breathing can be enough to get you off this high anxious point and reground you and bring you back to stability. So this is a technique called box breathing, designed to help you remember easily 4, 4, 4, 4. So you hold your breathing for 4 counts, exhale for 4 counts, hold again, 4 counts, inhale for 4 counts. So if you find yourself stressed, you can do something like box breathing. And if 4 counts is too long to hold your breath, just try it in a shorter amount of time. And make sure you're breathing from your gut. Literally, like put your hand on your belly and make sure you can feel your stomach rise, so that you can get those deep breaths in, the deep breathing, which can then send a message to the brain that says, there's no bear coming to chase me. You know, I'm not in a dark alley by myself with a kidnapper and a gun. I'm okay, because the brain can't tell the difference. If you're in a situation where you can't hear and you're anxious about it, or if you're in the woods and a bear is chasing you, your brain doesn't know the difference. And you need to boss your brain, and you need to tell your brain, I can't hear, I'll be okay. I'll change my breathing and make sure I'm breathing deeply. I'm going to stop sharing. Does that make sense? Can you give me a yes or a no? Yes. Okay. Okay, one more. Is that okay? Or are y'all too exhausted? Is that okay? Okay. I know this is long. This one is one of my favorites. It's a visualization, and it's called thought popping. So if you have a negative or critical or an intrusive thought that just keeps ruminating in your mind, you literally are going to pull it out. So this is a visualization. So you visualize, you see it across your mind what that thought is. So let's say the thought is, I'm not good enough to present to the HLAA chapter in DC today. Let's say that that's my thought. I'm not good enough. I see that across my mind. I'm not good enough. I can visualize that. So you close your eyes and you notice your feelings. As you think that and you see it, what is the emotion you're experiencing? Usually it's like, you know, crummy feelings, right? Like discouragement or self-loathing or disappointment or fear or worthless. So identify what those feelings is. And then you visualize that thought, and you're literally visualizing yourself remove that thought from your mind and put it in a thought bubble in front of you. So you're pulling it out. Like if any of you have watched or read the Harry Potter books where they use the wand to like pull memories out, it's something like that, where you're pulling out that thought and you're putting it in front of you. So it's no longer inside your mind, it's now outside of you. You notice that thought, I'm not good enough. And then you use a wand or your finger and you pop it and let it disintegrate. Then notice your feelings. Like it's no longer inside me. I don't have to carry that anymore. So maybe I don't feel as worthless. Maybe I feel like, okay, I am good enough. People do want to listen to me. I have good things to share. I don't need to feel that. That was just a distracting thought that doesn't belong inside me. That naturally is going to have an impact on what I do and how I feel and what I say. So notice your feelings. Was there a change? And if not, try it with a less critical or a negative thought. Okay, so those are three different therapy techniques that you can use in order to address anxiety. And there are so many more. So if you find yourself in a really anxious situation and it's not getting better, I really encourage you to look more into some of these kinds of things, to consider counseling. But I just wanted to give a quick tip. If you are struggling to find a counselor who is culturally competent with issues of hearing loss, because not all of them are, right? Hearing people have to be taught what hearing loss is like. And not everybody's culturally competent. If you're struggling to find somebody like that, then your next plan could be to find a therapist who has cultural humility, who's open to learning. And then instead of you providing all the education, this is what I need, you can send an article to them and say, before I come and see you, please read this so that you know how to work with somebody who has hearing loss, so that not all the work is on you to educate that person. So if you can't find a therapist who's already culturally competent and aware of hearing loss issues, then I hope that you feel empowered to tell your therapist what you need. I, as a therapist, love it when people say, you know, I don't know how much experience you have with this, or this, but I'd like you to get some more informed before you meet with me. Oh my goodness, I would love that. Thank you. Of course I will. I would be happy to read something like this if a client were to send this to me. So that's another option you have. This particular article, Culturally Responsive Social Work Practice with D and Deaf Clients, it's by a researcher, and it lists tips for therapists on what they need to do, how they should check in with you with communication wise, you know, how they should set up their office space so that it's the best listening environment possible, those kinds of things. And this isn't the only one. There's other kinds of things like this out there. But that's just my final suggestion, that you find someone who's open and humble, and then share some information. So that is all that I have. So quick overview. we talked about cognitive theory and how thoughts and feelings and behavior are so related, how that works for those of us with hearing loss, what some of the mental health issues are that are associated with hearing loss, that anxiety rates are higher right now among those with hearing loss, and then how to treat some anxiety. So that was a lot of information. Do you have any comment or questions for me?
I have a question.
Yeah.
Thank you. First of all, that was excellent, and I could relate to it, everything you talked about. One question, I know you're talking about anxiety. Do you have any tips? What I've noticed, because I just started going back to work just one day a week. The 2 days I've gone back to work now, I've come home and I'm so exhausted. And I haven't experienced that listening fatigue for a long time, ever since I got my cochlear implant. And now that's back because it's so hard to hear people with masks on. Do you have any tips for dealing with that exhaustion, that listening fatigue?
I love that question, Lisa. Oh my goodness, listening fatigue, it kicks our trash, doesn't it? So my college classes are 3 hours long, and I think it's so tragic that anybody has to sit through a class for 3 hours and have to listen for 3 straight hours. But yes, I experience listening fatigue all the time. So I feel like the best thing, and everyone of course has to find their own recipe and nice little solution for them. But I find that I have to protect my time. If I know I'm going into a difficult listening situation where my listening fatigue is going to be worse, then that means I schedule breaks for myself before and after where I don't have to listen to anybody or anything. And I can do things like meditation or visualizations to reground myself. And I also look I do my favorite things. Like I build in every day my favorite things so that I'm not, because I do a lot of taking care of others, that if I'm not protecting myself in some ways, I can get run ragged so fast. So I make a list of things that I can do when I don't have very much motivation. I have low motivation or low energy. And I make a list of things that I can do when I have high energy. And based on how much time I have and how much energy I have, I'll do one of those things to like reattune myself to me. And to make sure that I'm giving my brain a break from listening. That's some of my thoughts. Does anyone else have anything that you do to help with your listening fatigue? Yeah, Dana.
Hi. I think a big problem that a lot of us face is other people not understanding what our legal rights are under the ADA and other laws. And also, I think a lot of people with hearing loss don't know what their legal rights are. And because of that, they're not, they don't know that they can ask for real-time captioning or other methods of better communication access. And if they're not getting real-time captioning for a 3-hour class, for example, then they're under a lot more stress because if good captioning is provided, that's going to reduce the stress that we experience. But again, I think that maybe we need to provide an update to people with hearing loss about their legal rights and how to request what they need from different kinds of providers, including teachers and colleges. So what do you think about that?
You know, I think that's a conversation we should be having on a regular basis. What are our legal rights in this situation? And go and think about that and go in thinking about that. And then, yes, hearing about it on a regular basis and how other people are using their legal rights in situations to help themselves. That really makes sense to me and strikes a chord that we have to use them. We have them. We have to use them. So thank you for that. And it looks like Viola says she uses a breathing exercises to calm herself. Yeah, I agree. Using breathing exercises and mindfulness and meditation and visualization is so important to those of us with hearing loss. It is so exhausting to have hearing loss. Even with the good things that come, it's just exhausting. And we have to be able to know the things that will help us to keep going. Because our voices are needed in this world. A lot of people with hearing loss withdraw and don't participate in the world. Don't do that. I want all of you to participate in the world and join in the world because your voices matter. They matter. Use them. Yeah, Judy.
Thank you. And thank you, Crystal, for a terrific presentation. Good information. Thank you for your research. I guess I have two questions. Given the research you're doing and the results you're finding, which are pretty substantial, how then do you affect policy? I guess it kind of aligns to something. And the second question is much more personal. With all the strategies and tips and techniques and so forth, do you find there's a benefit to self-identifying as being hard of hearing as you meet new people? I mean, if I were at the ball game and I simply saw that person and I said, you know, remind them I'm hard of hearing, that kind of a get out of jail free card in some ways. I do want to talk, we do want to listen and hear, but for me, it sets a context. What's your experience with that, may I ask?
That's excellent questions. Thank you for those, Judy. So the first one about policy. We influence policy on so many levels, and I don't know if everybody realizes how much we influence policy or how much we should be influencing policy. So for example, I have to go to academic conferences and present research and listen to the research of other people. They won't caption their conferences in my field. And now the conferences people are wearing masks. So I'm going to these conferences and I'm trying to participate in someone else's research and they're not captioning their presentation, even though it's free to do it, you know? So I'm writing to the board and I'm complaining to the board and I'm talking to every single presenter. Please use your captions. This is how you do it. I have a sheet that I bring with me and I teach people how to turn their captions on in PowerPoint or in Zoom or in, you know, all these other platforms that we use. Because of my work and advocacy in those conferences, they're now starting to require that everyone learn how to turn on their captions before they can present. I've influenced policy change by doing that. Now that's on a conference level, not like on a national level. I'm going to send, it doesn't mean they're going to read it, I'm going to send my research to the World Health Organization and the CDC so that the next time we have a pandemic, that they, when they're implementing the things that need to happen, that they will at least have information about what happened to 20% of the world who have hearing loss, right? 20%, that they will consider what other options do we have. There's a whole group of people who is not doing well because of pandemic measures. How can we do things a little differently? So I'm not saying it will change anything on the world level yet, but maybe one day it will get there. So you can influence policy on your local level, public schools, school districts, who you're voting for, all of those kinds of things, like being involved in advocacy efforts. If you're employed and interacting with an employment situation, you can change their policies on how they make meetings accessible. So there's just so many different places that we can influence policy with some of this research. So that's the first one. The second one is that I self-disclose my hearing loss to everybody. Personal preference. I understand not everybody wants to do that. I disclose my hearing loss to everybody because I would much rather people think I can't hear than I'm stupid. That's just my own personal preference. And I've had so many experiences where people have thought I was incompetent. And that drives me batty. That's one of my weaknesses. When people think I'm incompetent, it does not do good things in my mental health. And I push back against that. So I would rather people think I have a hearing loss than I'm an idiot, right? But that being said, I also think there's so many people who are so afraid of their hearing loss, who are so hesitant to share information, who are so, who maybe haven't accepted it yet. Those voices don't get heard in our world. So I want to be loud on purpose to not just advocate for myself, but for other people who maybe don't know yet how to advocate for themselves or who don't want to advocate for themselves, so that hearing people receive more education. So all of my circles of people who are hearing, they know so much more about working with people with hearing loss because I say it all the time. Now I get tired from doing that. And there are times that I say, I'm tired of educating. Here's some materials, read and figure it out. So I just believe that we should tell people, but those are my thoughts. Okay, I've got some questions in the chat here. Has my work been published? So the only thing that has been published so far is related to not this kind of work. I have a publication that has been accepted and I just sent in the proofs. And so it will be published probably in a month or so. So when that happens, I will gladly send it to all of you. It is a publication about why we need to use captioning more often, everywhere. So I'd be happy to send that to you. And then if you want to go on my email listserv, so that when my dissertation research is published, because it's dissertation, I have to go through my committee and extra university hoops and those kinds of things before I can submit it to journals. But if you want to go on my list so that you see the publications when they're done, just email me and give me your email address and say you want to receive future research. And I just keep a list of people that are going to get any publication I have about hearing loss and mental health. It's coming. Okay. And then, oh, and yes, complimenting our captioner, who is awesome. Thank you for the good work that you are doing. Any other questions? Oh, Barry, it looks like you have one.
Oh, I am on mute. You talked a lot about self-destructive behaviors, suicide ideation, substance abuse, things like that. Did you also look at outwardly negative harm to others, violence or abuse or things of that, where a person with hearing loss dealing with stress acts out in negative ways?
Excellent question. I just did a systematic review of the literature where you look at everything that's already been written and published and try to pull pieces out of it to see and look for trends. And one of the things that came out in this research was that individuals with hearing loss, particularly very severe hearing loss, were very abusive in their intimate partners. Sexually abusive, communication abusive, verbally abusive to their intimate partners because so the reasons that they gave were lack of education, because they didn't hear about all the culturally appropriate and socially appropriate learning that we do throughout our life, but we do most of that learning in like side conversations, you know, like radio announcements that maybe we don't hear, or conversations that are happening on the side. So we do a lot of learning about our relationships and relationship boundaries not necessarily mom and dad sit you down and say, this is exactly how you should treat your intimate partner, you know? And so these individuals felt like they didn't have access to education and information, nor did they see good examples of appropriate boundaries and appropriate relationships. So I thought that was really interesting that came out as a trend in the research, is that they were abusive when they were frustrated because they didn't know how else to do it. And here's another really important factor. Another trend in the literature says that those with hearing loss and deafness do not have equal access to mental health care treatment. Up to 80% of those who need mental health care treatment who have hearing loss are not receiving it. So if I'm missing out on important learning opportunities and I'm not seeing good, healthy relationships, I'm not hearing how to improve those relationships, and I'm not accessing professionals that can help me improve my relationships, then I'm just going to do what I'm going to do, right? Anyway, so those are some of the trends that I saw.
Crystal, you've hit on something that has been on my mind for a long time, and we talked about it. And this is the problem that hard of hearing people, unlike deaf, culturally deaf people, don't find it easy to self-identify. I agree with you that, you know, sometimes the option is, would you really be thought of, would you rather be thought of as hard of hearing or stupid? But I don't think a lot of people think about it that way. They think they can bluff, so that it's not really a choice. They can hide the fact that they're hard of hearing without being regarded as stupid, you know, just by bluffing. It sometimes is tragically wrong, but that's a huge issue. I mean, because so many of the things that we're talking about require people being willing to say, I got a problem, you know, and you can help me. But you're not going to help me because you can't look at me and see that I've got a problem. I have to tell you about it. And people are very reluctant to do that. And then that seems like a very difficult, nut to crack. I'm not sure I've got there yet. So, yeah.
You know what? It's an excellent point. In my world, in the academic world, I don't have a choice, because I'm like on the fire constantly. Academics is so intense. That's the world where I'm like, I would much rather, I've been hearing loss and you think I'm incompetent. But some of my like social situations, when I'm tired, I don't want to have to explain again and again I have a hearing loss. And I would rather bluff my way through conversations. Like if I'm, for example, going to a sports team and watching my kids participate in sports, I'm not talking to the parents and developing relationships with sport parents, I don't want to have to talk to all of them. And they talk to me sometimes and I'm like, yeah, yeah, I have no idea what they just said, right? So I am still in situations like that. But if it's a relationship that is meaningful for me or has the potential to harm me or hurt me or help me in some way, those are the situations where I'm going to be so clear and adamant. But we all have to make different decisions, right? About who we disclose to and for what reasons and what we do in those.
We're running up close to the witching hour. And I did want to do two things. First of all, I wanted to thank you for, I think, a fantastic presentation. Thank you. And I wanted to thank Natalie for the captions. I mean, there were some comments, in the chat box, on the quality of the captions, which I think are exceptional. And we know that we've known Natalie at, DC chapter for some time, and she's terrific. And thank you, Natalie. And the second thing I wanted to do is just to make sure before we leave that Judy, on behalf of the DC chapter, and Lisa with an E, on behalf of the Montgomery County chapter, have a chance to say anything in closing, that they wish to. So let me leave it at that and thank you. And I'll turn it over to one or the other of them if they wish. Judy, your hands are up. Your hand is up.
I'll begin just by reiterating that this was an excellent presentation. I plan to use some of the tips and techniques you've identified. A personal observation, I find it takes much more energy to bluff because I have this subcontext of looking stupid than it does to acknowledge I can't hear and tell the other party what I need from them to allow me to hear. But I did want to very much thank you for the presentation. Just a reminder that the next DC monthly chapter meeting will be May 22nd, back to our Sunday at 2 o'clock time. We do get up early, at least. We just don't have meetings till later in the day. And that topic is for those who live in DC, work in DC, play in DC. You know, how can we plan and respond to emergencies, which in DC are increasingly frequent? So Lise, you may want to speak to, or someone from the DC chapter may want to speak to your next meeting details as well.
Thank you, Judy, and thank you, Russ, and thank you, Crystal. I know about 5 people I want to send your PowerPoint to immediately, besides all the people here who really appreciated your talk. So thank you. And thank you to the DC chapter for working with Montgomery County to make this a group effort. Really appreciate this, and I hope we'll do it again. I also heard from PG County in Maryland who said, hey, that's a good idea. Let's do that too. So thank you all. And if you want to come to our chapter meeting, you can do both the DC chapter meeting and the Montgomery County meeting, because ours on the 21st and DC is on the 22nd. So ours is at 10:30 in the morning, and we'll send out flyers to anybody who signs up. You can get, if you miss the email address, you can reach out to Russ or Judy, and then they'll forward it to me or to Hollis. So thank you so much. Should I turn it back over to you, Russ, to close us out?
Well, thank you all for coming.
It was wonderful. A great program. Thank you so much. Crystal, you did an amazing job. I really am glad I joined today. I really enjoyed everything that was covered.
Well, thank you all, and thank you all for coming. And just to, reiterate what Lisa was saying, the captions, excuse me, the recording will be available and will be sent to everyone, with the recording with the captions will be available. It will take a little bit of time, but you will get it. Thank you all, and thank you for coming.